Our next guest is Dr. Michael Scholtz, Assistant Dean for Extramural Clinical Practices at East Carolina University's School of Dental Medicine, and also he's the Director of Community Dental Practices and an Associate Professor. Welcome to our show today, Dr. Scholtz. It's a pleasure to have you here.
Well, thank you for having me.
You're quite welcome. Now, you have a long title, you have lots of roles, so I want you to tell me what you really do at East Carolina University.
Well, I was recruited to come down to East Carolina to be the director of what we call the Community Service Learning Centers. And my other title is Assistant Dean for Extramural Clinical Practices. And I have had the opportunity to oversee the construction, the equipping, the staffing, and the operation of our Community Service Learning Centers, of which we have 7 in operation now, and the one here in Brunswick County will be number 8.
And it's a beautiful building. It's fabulous, and I'm so excited for it to open. Let's talk a little bit more about the services that you might offer at this learning center.
Okay, the services, mission of our clinic is, of course, education. And so we are educating general dentists. And so the clinic will offer a full array of general dentistry, but will include some specialty type of procedures as well, such as implants and root canals and extractions and all kinds of prosthetics as well. So it's the full array of dentistry, but under the umbrella of a general dentistry type of clinic.
Now, when you say full services, they'll do cleanings?
They'll do, yes, just everything that you could possibly get done in a private dental office, and will serve all populations, from children to geriatrics. Yes, ma'am.
So, who actually does the dental work? Are they students?
Well, the way we have the clinic set up is that we have 4th-year dental students who will be providing care.
Okay.
Additionally, we have postgraduate, what we call advanced education in general dentistry residents, 2 of which will be living in the area for a year. And so they have already completed dental school. They'll be providing care. And then also our faculty dentists will be available to provide care too. So it's actually 3 different levels that will be able to provide care.
That sounds awesome.
Yeah.
How many days a week do you anticipate to be open?
We'll be open 5 days a week,
okay,
from 8 until 5, Monday through Friday.
8 until 5. And who else will be working at the clinic other than the dentist? Will you have other?
Right. Well, it's, as I said, it's based upon a private practice type of platform. So we'll have front desk personnel. We'll have dental assistants. We'll have hygienists. We have a business manager that runs the business side of the operation, in addition to the faculty dentists.
Now, the 4th-year students, when they finish their rotation, is it a year? Is that what they?
Well, they're 4th-year students, and what we do is have them serve 3 8-week rotations at 3 different locations at our service learning centers across the state. So Brunswick will serve as one of 8 areas where our 4th-year students will love to be able to come down here to serve 8 weeks.
At the beach.
That's right.
And so every 8 weeks there may be a change.
Yes, there will be. But as I said, in addition to that, we'll have the advanced education in general dentistry postdoctoral residents who will be here, who are already licensed as full dentists. They'll be providing care, and the faculty dentists will be providing care as well.
And you call these community service learning centers.
That's right.
Is there a philosophy behind why?
Well, yes, there is. As I said, the mission of the clinic is to provide dental services, but also it serves as an educational platform for our students and our residents who are completing not only their clinical requirements, but they're providing care to the patients that come in. So we call them learning centers because a lot of what's going on there is education. And the education works 2 ways. It works for the students and the residents, but also we're here to educate the general population about the importance of oral health.
Yeah, and that is an important thing here. And in Brunswick County, I think there's a lack of dental care.
Right.
Not the resources are here, but folks often either can't afford it,
right,
or just for some reason
right.
don't get it. And so I'm curious about the structure, the financial piece. Mm-hmm. Are there criteria that have to be met in order to be a patient?
No criteria whatsoever. We accept any patients who are full pay, full insurance patients, all the way down to people that might be eligible for Medicaid or health choice types of patients. So anybody that comes in the door, we make a good attempt to be able to treat.
Mm-hmm. And would there be someone there that might help them with that process? Because that's a hard...
Oh, absolutely.
To navigate that, it's difficult.
Yes, we do. We have front desk personnel that are going to be well trained in that, and then our business manager is there as well. Mm-hmm. Now, you asked about the fees. Our basic fee is at about 68% of the usual and customary fee that somebody would pay if they were going to a private dentist. So there's about a 32% discount because they are being treated in an educational situation.
Really?
Yes.
That's interesting.
Now, we'll also have some reduced fees for people that qualify. If they're at 150% of the federal poverty guideline or below, we will cut that down to 50% for them.
That's awesome.
Yeah.
So someone who has dental insurance, say, can also receive services there, and then you would bill their insurance company, or would
we be...
Yes,
we accept any dental insurance. We also accept PPOs. There's a number of PPOs that we're involved with, and the front desk personnel will take care of all of the insurance matters for all of the patients that come in.
I'm curious why you chose Brunswick County. Was there a method to that?
Well, each of our service learning centers are selected according to certain criteria, and one of the main things we look at is not necessarily the locality in which it's placed, but also what we're doing is taking a regional approach. And it's not only the needs in Brunswick County, but also there's a lot of need in Columbus County, Pender County, and Bladen County.
True.
So we're hoping, and our experience has proven, that each of our service learning centers, we have about a 4 or 5 county impact on the patients that we serve.
Yeah.
So we look at, in locating them, we really look at the number of Medicaid patients that are eligible. We look at the number of Medicaid patients that are enrolled, and then also we look at what we call the penetration of Medicaid, which means that how many people that are eligible for Medicaid are actually receiving services. So that's the main criteria that we base our location on.
Let's talk about making appointments. How does that happen?
All folks have to do is either drop by the clinic or they can call the clinic, and the phone number is 910-253-9000, and that phone will be in operation in probably about a week from now because the telephone folks have to come by and hook up all the phones still.
And when do you anticipate opening? We
anticipate opening towards the end of February, 1st of March.
Well, that sounds good. Now, I know that being close to the hospital, there's going to be a lot of interaction between the hospital folks and you all. Do you have any big plans for an opening, a grand opening, or ribbon cutting?
Yeah, we will certainly have a ribbon cutting up in April. I believe the date is April 18th.
Oh, good.
And it will be a big event where everybody in the entire area is going to be invited to that. Mainly because there have been a lot of stakeholders in us coming here, and so county government and public health and the hospital and other folks, a lot of people in Brunswick County have really been responsible for us locating here. So we want to thank them, and then also we want to have a big kind of opening party for everyone too.
Yeah, I know that the emergency department will be really happy to have you.
Yes.
Because oftentimes that's their local dentist.
Right.
You know,
and that's one of the things that we do in every area we go to. We develop a direct referral system from the emergency department over to our clinic to take that dental load off of the emergency department. So that's one of the things that we'll be doing with the Novant Hospital there is helping them in that area.
That's really going to be a real help to them. How about networking with local physicians? Do you anticipate going out and meeting with physician offices?
Yes, we do that in every location that we're located. We network as much as possible, with public health, social services, local physicians, whomever we can that might be referring patients to us. In addition to that, at each location we have an advisory board made up of members from the community, and we'll have folks that are in the education area, we'll have social services, we'll have business people, we'll have faith-based persons, and we have a board usually made up of about 8 people. And what they do is they provide us information and feedback on how we're impacting the region in which we're located. Hopefully we get good feedback from them. But then also, we really want to have community outreach projects for our students and our residents. So we ask them to help facilitate us getting our students and residents out in the area to do community service type projects.
Oh, I love that community service aspect of it.
Yeah.
I think that's a great way to reach out to the community. Do you have a website?
Yes, we do. You can just Google East Carolina University School of Dental Medicine, and it'll come right up.
We have a lot of East Carolina folks in this area.
Yes,
in fact, several physicians have graduated from the medical school there.
That's right.
And we really enjoy having them around. So.
Yeah.
It's been a pleasure to have you here.
Well, thank you
so much. Great job.
Yeah.
I look forward to the opening, and we'll see you soon.
Okay, thank you.